The theme for this year's World Cancer Day is Close the Care Gap, which also marks the start of a 3-year campaign to raise global awareness around cancer, especially on the most vulnerable citizens. Give us some understanding on what cancer really is and what does this day stand for?
Well, cancer is said to happen if any of the cells in the body begins to multiply out of control. So every cell in your body, some cells in your body actually can multiply and they die off. But when a cell becomes immortal, begins to multiply and begins to spread from one part of the body to other parts, causing damage, more or less, you have a cancerous situation in your heart. It's important and it's significant because worldwide, at least 20 million cases of cancer were diagnosed in 2020. That was last year. And half of the people who were diagnosed last year died. That's, we lost about 10 million people globally. In Nigeria, we have very low data on that, but the WHO clearly states that there's a significant gap. It's important that we commemorate this day so that we can draw attention to the challenges. If you look at critically at access to comprehensive care, because any patient who is diagnosed with cancer requires comprehensive care from a team of health practitioners, multidisciplinary team. So you need a doctor, you need an oncology specialist as a cancer specialist, you need nurses, you need pharmacists, you need caregivers, all forms of people to come together to give comprehensive care. It is agreed, it is known that in low and medium income countries where Nigeria belongs, less than 15% of patients who are diagnosed with cancer have access to this type of care, as opposed to more than 90% of patients in the high income countries like in the West. So the gap is significant. And to paint the picture much further, if you look at children under 5 who have cancer, the chances that they will get access to care and be alive 5 years after their diagnosis is less than 30% in countries like ours, low middle income countries, as opposed to 80% in the high middle income countries. So the opportunity for the early diagnosis, the opportunity for access to prevention messages, the opportunity for long-term survival, and even the chance of achieving cure is extremely wide between high and low middle income countries. That is why the WHO has said that we have to close the gap. And coming to how do we close the gap, we have to look at what the structures for care are. You have to look at healthcare financing. What is the financing model we are uploaded? You have to look at access to information. You have to look at structures for staffing, structures for services, logistics systems for delivery of medicines and care inputs and consumables. For Nigeria, for example, to bring home this argument, if you look at healthcare financing in Nigeria, we have less than 5% of the Nigerian 200 million population accessing health by insurance. Even if comprehensive cover for cancer is not under national health insurance in the way it should be, but some aspects of care, like some support tests and all that, may be available. But this is completely a small number of the population, meaning that a significant percentage of the population do not have access to support in terms of insurance and healthcare. So healthcare financing is a big issue.
Okay, now, Doctor, research says every year Africa records around 1.1 million new cases of cancer, resulting in about 700,000 deaths, especially with infections like breast cancer and the likes, accounting for almost half the new cases on the continent annually. Now, with all the statistics that you've given, why is this so in Africa, and what could actually be responsible for these huge cases in the continent?
The cases for the continent, the high death rates for the continent are all as a result of a system failure. The health system is not operating at its optimum. For example, 70% of patients who have cancer and are diagnosed in the continent are diagnosed at stage 3 or stage 4. So for the benefit of our listeners, most cancers have 4 stages: stage 1, stage 2, stage 3, and stage 4. Stage 3 and 4 are accepted to be the late stages and are more associated with death. Stage 1 is early stage, and you may be able to achieve cure or delay the duration, a time it will take for the patient to die. Unfortunately, due to the failure of the system to provide a robust screening infrastructure and give this and provide access to this screening infrastructure in our population, that is one. Failure of the system to provide opportunities for early initiation of treatment, and even when these opportunities are available, chances of financing them, because the treatment for cancer is humongous. In a population where you have at least 80%, 70% of the population living below poverty line of $1.25 a day, you can imagine that it's impossible for some of these people to finance even treatment for malaria. Come to talk of the cost, the highly expensive cost it requires for treatment for cancer. So cost is a major problem. Access to screening is a major problem. Other issues, obviously, will be things like cultural beliefs. We have a highly traditional and religious societies. Most of the health conditions that are unfathomable, unexplainable, based on the level of ignorance, are attributed to spiritual attacks and all forms of things. So you find out that a significant number of a percentage of our population believe that some of these cancerous manifestations may just be spiritual attacks. So this leads to delay in the initiation of treatment. So we have problems like the healthcare financing. We have problems with services, the quality of services, access to services. We have problems with staffing and financing. We have problems with delivery of medicines and consumables in the system. And to wrap it all up, we have problems with leadership and governance in the healthcare sector to provide a comprehensive approach to providing the services that are required.
All right, Dr. Ebuta, I would have to interject right now, but then to wrap this up, some say cancer patients have poor awareness in terms of learning about the disease. Do you think it is underreported? Quickly, your thoughts on that, and what can be done quickly to see to that these problems that you've highlighted can be solved?
Definitely. Any country that has the capacity and puts things properly would have what you call a cancer registry. The cancer registry in Nigeria are rudimentary or are non-existent in a lot of places. So we cannot report all the cancer cases. That is one. What do we need to do as a country, as stakeholders, as corporate social responsibility and the organized private sector? We need to come together to set up what we call the National Cancer Center. The National Cancer Center is envisioned to provide leadership for cancer care. It's a comprehensive center where people can go and get all forms of care, comprehensive care. It can act as a training hub where people from other centers can go to experience what it is to obtain comprehensive care.
Thank you.
It can serve as a platform where healthcare financing models can be tested to see how many people have.
All right, thank you. Thank you so much. Thank you so much, Dr. Ebuta, for joining us on the news. Really appreciate your presence.